Pharmapulse, medicine made visual. Have you ever wondered how a dentist can drill your tooth without you feeling pain? The answer isn't magic. It's one of the greatest discoveries in pharmacology. Every tooth is connected to your brain through specialized sensory nerves. These nerves constantly monitor temperature, pressure, and pain.
When tissue is injured, pain receptors called nociceptors become activated. Their job is to warn your brain that something is causing damage. Pain doesn't travel as blood or chemicals. It travels as electricity. That electrical signal is called an action potential. As sodium channels open one after another, the electrical impulse rapidly travels toward the brain, carrying the message of pain.
When the signal reaches your brain, you're finally aware of the pain. But what if we could stop that signal before it ever gets there?
This is where lidocaine comes in. Instead of acting on your brain, it works directly where the pain signal begins.
Because lidocaine is able to diffuse through tissues and into nerves, it reaches the exact place where electrical signals are generated.
Its target is a tiny protein called the voltage-gated sodium channel, the doorway that allows sodium ions to enter the nerve. Once lidocaine blocks these channels, sodium can no longer enter the nerve. Without sodium, the electrical signal simply stops, and the pain message never reaches your brain. Imagine cutting the wire to a doorbell. The button is still pressed, but the signal never reaches the bell. Lidocaine does exactly that to pain signals. Unlike general anesthesia, local anesthetics don't affect your brain. They only block nerves near the injection site, so you remain fully awake and aware.
Since the nerves can't send signals, your brain doesn't receive information from that area. That's why the region feels numb instead of painful.
Small pain fibers are blocked more easily than larger motor nerves. That's why pain disappears before muscle movement is affected.
Many dentists combine lidocaine with epinephrine. It narrows nearby blood vessels, keeping the medicine where it's needed for a longer time. Over time, your bloodstream carries the medicine away. As lidocaine leaves the sodium channels, the nerves regain their ability to conduct electrical signals. That's why the numb feeling slowly disappears over a few hours, and normal sensation returns without any permanent damage.
Local anesthetics are used far beyond dentistry. They help make minor surgeries, wound repairs, nerve blocks, and epidural procedures much more comfortable.
When used in the correct dose and injected properly, lidocaine is one of the safest and most reliable local anesthetics in modern medicine.
If excessive amounts enter the bloodstream, lidocaine can affect the brain and the heart. That's why healthcare professionals carefully calculate the dose and inject it with proper technique.
Before injecting, clinicians often pull back on the syringe to help confirm the needle isn't inside a blood vessel. This simple step reduces the chance of the medicine entering the circulation directly.
Here's an important pharmacology pearl. Local anesthetics that are more lipid-soluble are generally more potent, while those that bind more strongly to proteins usually last longer. Local anesthetics are used in dentistry, emergency medicine, surgery, dermatology, and many other procedures where pain needs to be controlled without making the patient unconscious. Let's review the entire process. Injury activates pain receptors. Sodium channels generate an electrical signal. Lidocaine blocks those channels, stopping the signal before it reaches your brain. Learn something new every day.